Welcome to today's show or podcast. Today with me, I have Hana Lang. She's a registered midwife right here in Terrace, BC. And I'm so happy to have her with me because she's so amazing. She's super cool. And we have so much to learn from her today. So welcome, Hana.
Thank you. I'll do my best.
So to start with, you're a registered midwife. Can you tell us a little bit about what made you to be a midwife or why you choose that profession?
Yeah, it's so funny. I didn't know what a midwife was until I applied to the program.
Mm-hmm.
So basically, I have an undergrad in cognitive science.
Oh, fun.
And I assumed that I was going to go into research. I did like an NCERC summer program at Oxford. And it was so lonely. It was so lonely. Research is so lonely. So I was like, I don't want to do this. So my girlfriends at the time were all going to law school. And I was like, well, maybe I could be a lawyer. And then some random person was like, have you ever thought about midwifery? And I was like, I don't even know what that is. I was like, oh, they make $75K a year. That sounds great. I'll apply. And then I got in. And I just got really lucky because I love it.
Did you take your midwifery here in BC,
No,
or where
so
did you?
I went to Ryerson
Okay.
in Toronto.
Okay.
Now it's called Toronto Metropolitan University,
Okay,
but
cool.
yep. So that's
So
where
cool.
I did my degree.
And is it where you from? Are you from Ontario? Or? Oh, fun.
I know.
Okay.
I moved from Toronto to Hazelton
Okay.
in 2020.
Okay. And then you're already a midwife.
Yeah.
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 So I graduated in 2017. I started the program in 2013. So yeah, it's been 12 years that I've been doing birth.
So amazing. And then once you went in, it's like now getting like it's just
and I've sort of done different iterations of midwifery.
Yeah.
So it's very different in Ontario than it is in BC.
Interesting. Yeah.
And I think I've really hit the sweet spot here in Terrace.
Yeah, we're so lucky to have you.
I love it.
So we're so lucky to have you. And then when you touch base with the midwifery, can you tell us more about it? Because I still feel like there's people still either confuse midwifery with having a doula, or they don't understand the scope of practice, because I find the scope of practice is so wide, and you become a primary care provider for the period of pregnancy and postpartum. So if you can tell us about
For sure. So it's a regulated medical professional. So it's a 4-year science degree with a 5th year that's kind of like a residency. And it's funded by the government. So I think one of the misconceptions that I am running into here in Terrace is that it's like something you have to pay for.
Yes.
And you don't. Yes. So midwives will care for pregnant people from the second you pee on a stick until your baby is 6 weeks postpartum.
Yes. I think that's so amazing, because I think many people don't know. Now, does that fluctuate? Do people's misconception, is it because it fluctuates from province to province, or is just a thing, notion out there?
I think in the north, there aren't a ton of midwives.
Yeah.
But provincially, we actually attend 31% of all deliveries in British Columbia. Yeah. It's pretty cool.
Now, for people that they haven't had a midwife before, and then they thinking about having a midwife at the birth or through pregnancy and postpartum, what's the difference? Is there a difference between having a doctor, family doctor, or a delivery doctor and a midwife?
Yeah, so midwives work in so many different ways provincially. So I can't really speak to, like, in the South, there's a lot of collaborative care clinics where midwives share call with doctors.
Yes.
I can speak to like my own practice. So like, I don't know anything about like a 6-year-old with like diabetes and hypertension. Like, I know nothing about that. I know a lot about pregnancy, delivery, breastfeeding, postpartum. Like, I don't know anything about a 2-year-old. Whereas a doctor, they have more of like a breadth of knowledge. I know a lot about a little. I think what I value about my own practice above everything else is continuity. So I think it kind of depends on what people value. Like, if they're like, I really want to like build a relationship with one person over the course of my pregnancy. And like, you know, there aren't a lot of providers here who do what's called primary call. If you're someone that's like, you know what, I don't really care. Like, I just want a doctor to deliver my baby. That's great. So at the prenatal clinic, it's awesome. They have a group of providers who all do prenatal care, and that same group does deliveries. For some people, that's awesome. For other people, they're like, you know what, I really want one person. So that's probably the biggest difference.
Which is, I think, becomes so specialized. Because I think back in the days, doctors, like maybe like 50 years, like a bit long ago, I think you would have the doctor who was your family doctor and then delivered you and then delivered your kid. I think I have a few people in town that they're older now, they delivered, you know, they delivered them and then their kids, but there's no longer a thing that your family doctor will show up at your birth.
One in town.
There's one we all know. There's one in town that still will come deliver yours and your other baby.
And I think those folks are very lucky.
And then that's so nice.
And then if something presents during your pregnancy that falls sort of outside normal, I just consult directly with the OBGYN on call. And kind of go from there.
And I think maybe sometimes people have like a fear or not reaching or not sure about a midwife because they feel like, oh, what happens if something happens? But that's a thing I think that again, that you will, you know, midwives will collaborate with other doctors or specialists. If something shows up, you can't solve your study. It's not like you're going to be sitting on somebody who's brewing something, you know? And I think, I don't know if I feel like there's a misconception that, oh, a midwife will, you know, I'm stuck with a midwife. And then if I'm having a high blood pressure or whatever, I can't get help, but that's not true. So I feel
when I was in Hazelton, provided care to a lot of high risk folks, and there weren't any other providers but midwives in Hazelton. So it was great because I got to develop these really beautiful working relationships with the OBs here.
How do you feel about birthing plans, or where do you see birthing plans being utilized, or is it still helpful for people to have one? Which is so nice.
I love them.
Thank you.
They're amazing.
Now, I have some burning questions and hot topics to cover today. So, and I know you, and I love how I know you're so passionate about them. So, number one, I was going to bring up, it's the birthing plan and plans. How do you feel about birthing plans, or where do you see birthing plans being utilized, or is it still helpful for people to have one?
The cool thing is, I think now a lot of the points in people's birthing plans are just like best practice. So they're just things that like we routinely do. So delayed cord clamping, skin to skin, no episiotomies unless there's like, you know, an emergency and a strong indication. I think these are conversations that I have with people sort of ongoing throughout pregnancy. But like there's some cute things that can be in birth plans too. Like I want my mom to cut the cord, or I want, if possible, my partner to help catch the baby. I think they're beautiful. I think the most important thing is flexibility, though. I think it's sometimes I see when people have these really rigid ideas or preferences, that can be a little bit tricky. So again, these are conversations that I have with people kind of throughout pregnancy to be like, yes, this is the goal. And I will do everything I can to like make that happen. But as long as it's safe.
Yes. I think it's so nice, and especially too, like when we continue to care, you know, having a midwife that you guys can talk about that. So the birthing plan is always hers or their family ideas, or can be heard throughout the whole pregnancy, not just like you show up and you're like, this is my birth plan, and you're pushing and you're like, okay, I have time to like look at this now. So I think it's nice because you're prepping with them. That's awesome.
I love that.
Yeah, thank you. Now the next question, which I know you're very passionate about too, it's about pain management and epidurals. It's such a big thing. Can you elaborate on the epidural
100%.
pain management?
I think epidurals are a beautiful intervention. I think, especially the way that they're done in Terrace. I find when someone is sort of like, you know, they're managing well, they've got good support, but sometimes when they sort of dip over into suffering, I will often say like, hey, do you want me to tell you what I think you should do? And a lot of the time it's like, I think you should get an epidural. I have never had someone who's sort of in that place of suffering get an epidural and say, oh, I really regret doing that. I think sometimes it allows for presence. It allows for them to sort of like experience joy in a way that like when you're suffering, it's really hard.
Yeah, it is. Yes.
Yeah. And like for me, like 100%, like if I have a kid, like epidural. I also love morphine and gravel in early labor.
Yeah.
So early labor, like you need to be resting, you need to be relaxing. And I think it's really helpful to get pain management in early labor so that when active labor starts, you're not absolutely pooched. The other thing I find with epidural is that sometimes it can actually relax the muscles and the ligaments in the pelvis. And I often see people get an epidural and then boom.
Yeah, we just go sit how many times, get everybody walking and be fully and ready. Get towels.
Like get an epidural and then, babies in the perineum.
Yeah. It's actually we see it more often. I feel like they're not.
Yeah. Especially if it's timed well.
Yes. That's the thing. Not too early.
Yeah. If you're getting it when you're like 5, 6, 7 centimeters, like that's beautiful. Yeah. I'm also someone that will say, look, you're 10 centimeters, you want an epidural, I will get that for you. I do not care. Yeah. Like I will do everything I can to make you comfortable and support you.
Yeah. No, it's amazing. And I think people's pain perception, I guess, too, or how people tolerate pain. Because again, I've seen some women laboring with naturally, and then not even, I know, and I feel like for me, I was like either screaming my head off and everyone could hear what I'm doing, versus like some people, again, it's just depending how they vocalizing or even verbalizing or perceiving the pain, I think, too. It's so interesting.
Holiday Tyson has a really great set of prenatal videos on YouTube where she talks about epidurals and, who they're helpful for and why.
Yeah. That's so good. It's so good to know. Mm-hmm. Thank you. Now, the next one is, again, we're talking about interventions. It's, again, the notion out there about inductions, and induction leads to C-section and, all that kind of gem.
When inductions are indicated, so like, you have high blood pressure, you have gestational diabetes, there's not enough fluid. Like if there's a medical indication for induction, I think the important thing to keep in mind is that recommendations are based on evidence and research. Mm-hmm. So if we're sort of recommending an induction, it's because there's a significant body of research to say that if we don't, you're at increased risk of a really bad outcome.
Yeah.
So I think that's important for people to understand. And when it comes to just like post-dates induction, you have options.
Yeah.
So between 41 and 42 weeks, you can choose to do whatever you want at any time. Yeah. But getting a BPP, like keeping a closer eye on baby to make sure the placenta is still working well. If it's important for you to enter labor spontaneously, then that's an option. Yeah. That's supported by research.
Yes. If your client end up having a C-section, what happens in that case? Can you explain what your role is then?
Yeah. So I have privileges to do surgical assist.
Which is so cool.
Yeah, it's really fun. So oftentimes if a C-section is indicated, then I scrub, I help the surgeon, and I'm kind of on the surgical side of the drape, but I'm still there, which is really nice.
Yeah.
The operating room, like after the surgery, pulling the drape down, sort of debriefing everything. And
which is so good. Yeah.
It's really fun.
Yeah, and you get to be there, which is, again, I think the continuity of care, I think people are just, again, so lucky to have you.
I am.
And then now that we talked about the C-sections and you having, working with doctors online, another hot topic I want to bring up again is, there's kind of misconceptions or a conception or, people assuming that doctors and midwives don't get along. Is that true from your experience, especially being in Terrace, or what can you say about that?
I think that's probably something I experienced more in Ontario, where it just didn't feel quite as collaborative.
Yeah.
In BC, not my experience at all. My mentors, both of my mentors in the North have both been physicians that I respect so much. Like my mentor in Terrace is like a physician who has like been there for me in a big way over the last 5 years. There are no bad options for prenatal care delivery in Terrace. We're really lucky.
We're so lucky.
Like I think Terrace is one of the most special place I've ever worked.
Yeah. Thank you.
I love it.
Now going into another hot topic, it's birth trauma. Can you touch base on it? How you how do you find birth trauma, or how you help your clients to go through if they are experiencing any?
I think debriefing frequently, early, and often.
Yeah.
So I will debrief with like my patients or my clients sort of after the birth, on day 1, when I see them at home, because it's one of those things that sometimes it won't present itself until like 3 weeks or 3 months.
Yes.
And then accessing counseling is so important.
I know.
So important. And we're lucky in town. We have a really great birth trauma counselor. Yeah. But I think debriefing frequently, early, and often.
Yeah. I know even our nurses, I know this in the hospital, they will actually debrief, after birth, if whatever they feel like something happened, or even doesn't even have to be a big thing, but something maybe that wasn't expected. I know all the nurses, I'm so proud, they will go in, they will revisit and say, can we do, and they will do debriefing with the partner and the client. And I think it's so beautiful.
And I think that the question that I try and ask family, birther, whatever, is like, do you understand what happened and why?
That's so good.
I think a lot of the times when something traumatic happens and folks don't understand sort of what happened and like maybe what led to like the emergency decisions, then that contributes to sort of like this rumination.
Yes.
If you're able to take the time and be like, okay, this is what happened here. This is what happened here. At this point, this decision was made and this is why. I think that can be helpful.
Yeah. No, that's so good. And I think we do such a good job at it. I don't know about other hospitals or other, again, settings, but I think we do so good at it. And it comes from like many layers. Like, you will address, the doctor will address, the surgeon will, like, there's even anesthesiologist will come up and then say, how was your experience? Which were my next point. Living in rural BC, I'm not sure people know, we live in Terrace, BC, up in Northwest. I think we got 12,000 people, give or take. And that's like a big radius, including, I think, smaller, like all the farmland and stuff, right? I think
and our hospital is often caring for folks from different cities because we're like a regional hub.
So now we see so many people from outside. So do some moms maybe feel a bit hesitant that, I'm, going to be birthing in a small hospital? Do I have any disadvantages, right? Or
as someone who worked in Hazelton for 5 years, where there's not access to C-section, where there's not a pediatrician, where there's not a physician that can do an emergency surgery, like, no, this hospital, this is amazing.
Yeah.
I think the resources that we have in Terrace are phenomenal. Yeah. And it's like, it's small enough that everyone really well. You know what their roles are. You know who to call for what, versus like a super big tertiary care center where things are a little bit more anonymous. I think the beautiful thing about Terrace is that all the providers have a relationship with each other.
Yes.
Which I think contributes to really good care.
Yes.
The thing to keep in mind is that if there's a complication like during pregnancy that is significant enough, our OBs will suggest relocation to somewhere like St. Paul's or BC Women's.
And then it's so beautiful, that they can pick that up and not let you just, again, same as when you have a midwifery, if you need something, you step up to the next level.
Yeah, exactly.
It's awesome. I think that's reassuring for moms too.
And I think the other thing folks don't always know is that in BC, we have access to consultation from like neonatology, maternal fetal medicine, like perinatal. We have access to those really, really highly trained specialists down south. So that if something presents in labor or, even in after baby's born, like our consultants will consult directly with those high level specialists.
My next question for you is about, do you see moms having guilt like after, and then I feel like that's just as a mom, mom guilt's always there. Like, doesn't matter what you do, if you do good or bad, mom guilt's always there. Do you feel like that presents itself at birth or after birth as well? Do you see it?
I mean, sometimes I think I try and reassure parents that like they made the best decisions they could with what they knew at the time. That's and that's kind of parenting, I think. It's like, it's a series of choices. It's a series of decisions. You're not going to do it perfectly all the time. I try and redirect people when I can towards like, okay, how are you going to find joy? Because I think it's really important that when you look back on early postpartum, whatever, it's not going to be joyful the whole time, but there are like flashes of joy.
Yes, versus just like suffering.
I try and reorient people to making that the goal.
Yes. Now we're talking about moms. Feel like having a midwife offering that 6 weeks postpartum care makes a big difference that you are still being cared for.
Yeah, I think most people that have midwifery care find like the postpartum care incredibly valuable. I think there are lots of other, like if you have a family doctor, like that's great.
Yeah.
I think having someone you have access to kind of 24/7 in the first 6 weeks can be really helpful.
So beautiful.
Even for just like, oh, there's blood on my baby's umbilical cord. I'm scared. Is this normal?
Yeah, because it's so nice because at the end there, after postpartum, you're not just a mom care provider, but you're also looking after a newborn for 6 weeks, and it's so beautiful. You know,
me right now, this is kind of an evolving thing, but right now I'm providing care for the first month at home.
Yeah,
and then at 6 weeks, I get people to come back, come into my clinic office.
Yes.
Yeah.
And it's so nice. And then you're able to like you're able to have breastfeeding support. You're able to do baby's weight, all kinds of things, which is like it's such a nice package together.
Yeah, and like I'm not a lactation consultant, so if the patient's encountering difficulties that I can't fix, sometimes I can fix it, but sometimes I can't. Then that's when I refer to.
What's the one piece of advice that you can give moms going to birth or going to their pregnancy that will kind of help them through, to some positivity?
I think it's really context dependent. So I feel like part of my job is to help people identify what they're scared of. And then kind of we work on that.
Because it's so different, right? Not everybody's different. We all come from different backgrounds.
So some people are really scared about like pain in labor. Other people are really scared about tearing. If folks have had any trauma with births in the past, then we sort of chat about ways that we could, put a plan in place to mitigate that from that risk from happening.
And that's so nice. And I think it makes it individualized care. So it's not like one cookie cutting thing, it's just everybody's so different.
Yeah. And I think it's important that people know their provider, whoever it is going to help them problem solve. And they really don't have to figure it out all on their own.
Yeah. And I think that helps when you're like, oh, I'm not alone.
No. Absolutely.
So my last question for you before you go, are you open right now? Do you have like an open schedule that are you accepting clients, and how do people refer to you? How do you find you?
People can self-refer.
Okay.
So I think there's like this idea that you have to go to your doctor when you get pregnant, your family doctor, which you totally can.
Yeah.
You can also pee on a stick and then go to my website and submit an intake form.
And I will put Hana's website and contact info into a link, and then you guys can always find her from there. Perfect.
Sweet.
Perfect. Thank you so much.
Thanks, Letti.
So thank you for joining me. I'm so happy that you shared all your wisdom and your insights about birth and all the hot topics that I wanted to cover today. It's always burning. So thank you so much.
My pleasure.
We love you so much.
Thanks, Letti.
Thank you. Bye.